Do you suffer from tension headaches in the back of the head and you feel that you need some sort of solution? Well, if so, I've seen many patients with this issue, and if the front muscles are in good shape, patient has extreme neck sensitivity in this area, I often recommend using massage roller or something similar to get those areas treated. Now that I've covered neck-related issues from multiple angles, I'm also interested what else can be tried to relieve this pain, and is there any handy tools for use. As new and exciting things pop up in the market from time to time, I do get also interested, and this time I have fallen victim to ad. I came across with this JVT Wellness production, Atlas Care and Atlas Touch online, and started to wondering what it brings to the tables differently. So I compared this to baking roll. Then I contacted the product maker and asked, could I get both products at home to try? And they are now here. However, I decided that I would not get paid to advertise the product, and I could keep my own opinion about this video content. If the spoken words do not please the product manufacturer, then this video body text will be in Google Drive, or I just simply delete it. Over half of the people suffer from tension headaches at some point at their lives, and it occurs in all age groups, even with the children. However, the prevalence of the symptoms decreases with the age, but if you have the symptoms present, do you want to wait or do something for it? That's for each individual to decide. So, when does this become chronic challenge? When there are more headache days in a month compared to symptom-free days. The exact cause of the tension headache is not really known, but tension of the muscle in the neck, shoulder and scalp is associated with the development of the pain symptoms. But it doesn't not explain the entire symptom package. Tension headaches are typically associated with the ischemic pain mechanism. Ischemic pain mechanism means that the muscles are trying to support the posture. When lactic acid begins to build up in the muscle body and its ability to fight lactic acid weakens, then we need to start moving the affected area to get oxygen blood to the structures. Is when the steady squeezing, tightening, headband or band-like pain intensifies towards the evening. When the front muscle on the front, frontalis, and the occipitalis muscle on the back tense up, the symptoms may be felt in the scalp area. If you feel that you are on a Swedish ferry and there is a slight vague dizziness, it's also very common for symptoms of tension headaches. If your symptoms include red flags in addition to above, the only right place is to go to the doctor. I have made short video about the back pain, so you can access it from above, or if you wish, it will going to be down at the description. Thinking about the upper neck and its structures, the second cervical vertebrae is the axis, the body part of the vertebrae with the large posterior arc in the upper cervical spine. Above is the atlas vertebra number 1, which supports our head. The upper neck has strong support provided by the tendons. However, if there is an underlying injury or rheumatic diseases, the condition of the tendon is somewhat uncertain, and maintenance measures on the upper neck should be done very carefully. Right at the base of the skull and between the first cervical vertebra, there is a small muscles, rectus capitis posterior minor. The obliquus capitis inferior provides the rotational movement of the upper neck structures. When the next layer of the muscle bodies are put on, more straight muscle bodies are added. Rectus capitis posterior major, and from the lateral process of the second vertebrae to the skull, a muscle runs down. The obliquus capitis superior is working in there. On the top of these muscle bodies comes the semispinalis capitis and the splenius muscles, which are already considerably larger in mass and make good movement for the cervical spine. When you add incredibly large muscle body, the trapezius muscle, on top of that, you start to get pretty good idea about all the structures in our necks. Now that the Atlas product family is 5 cm wide and the head weighs approximately 8.2% from the body mass, they are intended to stretch very specific structures. When the head is tilted slightly forward, you come from the middle of the back of the skull and you descend from there. You will going to come to this U-shaped area at the neck set. From the middle, when you continue downwards, you will going to hit the posterior arch of the second cervical vertebrae. Now, when you enter into this area, if your sensitivity or pain generally hits the center 5 centimeter area, then these tools can be helpful. However, if you feel that the middle third or the outer third of the neck is the bad spot, then you won't be able to reach these structures with this tool, and then lacrosse, massage or fascia ball is in order, or rolling pin or baking roll. If you lie on the floor and place the atlas touch or care on top of the first cervical vertebrae or the atlas and between the skull, then the weight of the head puts slight pressure on the structures. When you wait here, take deep breath through your nose and let the structures relax. You will going to get this stretch exactly the right place. Here's a little tip what came to mind during the editing process. If the atlas care or touch feels too firm at the first, then grab a towel or even thick shirt and place it over the product in the way that it softens the pressure of the nuts. Fold the towel 2 to 3 times over and then gradually reduce the layers as your neck gets used to the setup. And back to the video. In such pressurized patterns, you only need to hang out for a minute or two, several times in day if necessary, and if the severity of the symptoms start to decrease as a result, then it's going good. If the severity of the symptoms continues to decrease as the days go by and the symptom-free time starts to appear, I typically instruct people to do the maintenance for 1 week of symptom-free time, and they can put the maintenance on the hold. After that, when you continue to live your active life, that is the most important thing in the big picture. However, if the head support test gives you very poor results or the worst palpation sensitivities are found in the side of the back of the skull, check this video, and thank you for your time.